Hello everyone, welcome back to KXAN Live. I'm your anchor Esmeralda Zamora, and today we have another one of our KXAN interns joining us for a look at their story that they have been working on throughout this entire semester. And with me to do that is Gracie Kirshner. Gracie, thanks for joining me. How are you doing today?
I'm good. Thank you for having me be here. I just have one final left, so after that, I'm good to go.
And throughout your journey here at KXAN, throughout your internship, you've been working on a big project that was published today. Talk to me, how has your journey here been? What's the experience been like, and what has it been like to work on this article?
Honestly, working here has been so rewarding. This past summer, I worked at Fox 5 Atlanta, and I got kind of a foundational experience in local news, and the summer before that as well, actually. And then now I've kind of developed my skills and worked a lot of one-on-one with all the people here who are so amazing and so funny and so fun to be around. And I just have really grown as a journalist. I think one thing that we do at KXAN that really separates us is our ability to go in depth with stories. I think that our stories, we don't just let the story of the day be the story. We make sure to talk about how it relates to our viewers in the past, how we can expect this to impact us in the future, and just the overall deeper meaning about what's going on in the news of the day. So that's definitely been something I've really grown to appreciate and learned to implement myself in this article.
And that article that you're talking about has to do with Texas abortion laws and a strain on women's healthcare, on the women's healthcare workforce. How did you come up with this topic, and when did you decide I'm going to report on this?
I've always been really passionate about abortion rights and legislation. After the Dobbs decision in 2022, I decided, this is something that I really care to report on. And I tried to figure out what I could report on. How can I tell the public something that they don't already know? And in this scenario, I didn't even know this myself, but the actual workforce is being impacted directly, as well as in overall residencies and medical education in the state. And that's something that I didn't really think of. I didn't think of the scope of this legislation in terms of education and patient care.
And throughout this journey, what is the current state of the women's healthcare in Texas that you have discovered?
Something I've discovered is that a lot of Texas doctors are considering leaving the state, have already left the state, are planning to retire early. A lot of them fear for what women's healthcare looks like as we move forward. And a lot of them don't even really understand the law. That's 30% of them saying that they don't even understand the law that they have to work around every single day. So that's something that is definitely impacting us as a state. I also didn't know that almost half of the state, as we know it, are maternal health care deserts, meaning that they have to drive over an hour for labor and delivery care. This in itself impacts the women of Texas, families in Texas, anyone trying to start a family in Texas. So that's definitely something that came to light during this article.
And Gracie, how have OBGYN residency programs changed with this legislation?
So while doing this story during my interviews, I was asking, how are doctors training other doctors? How are we retaining new doctors? And something I learned is that our residency programs within the state actually don't teach all of the necessary procedures for abortion. That is, some medical schools are sending their students for 3 to 4 weeks to another state to learn the necessary procedures. Sometimes there's optional courses which add more length and detail, but overall, to be registered by the American College of Medicine as a doctor, you have to know these procedures and be trained in them. And that's requiring our state's medical programs to find other solutions, farm those programs out, teach the procedures on things other than the way that they've been teaching them. So that's definitely something that's really interesting and future residents that are applying should know.
And Gracie, throughout your reporting on this article, you obviously had to speak with certain experts within the field of the women's healthcare field. Who did you speak with? What did you learn?
So first, I talked to a medical student, Liza Meyer, who really, really wants to be an OBGYN. And I talked to her about what does this look like for you going forward? Are you planning on staying in Texas? If you stayed in Texas, what would that look like? And then I also was able to speak with a few really amazing OBGYNs, Dr. Emily Briggs, Dr. John Thoppel, and then Dr. Anitra Beasley, who is the Assistant Dean of the Baylor College of Medicine OBGYN program, one of the assistant deans. So let's hear from her about what she had to say.
Are we going to have more applicants who don't think that comprehensive reproductive health care is important? Are we going to get to the point where we are actually not filling our residency spots because people don't want to come to Texas because they're not getting a comprehensive education?
And from this conversation that you had with her, what was your biggest takeaway?
She is a researcher, a doctor, and an educator. She wears very many hats. And one thing I really wanted to focus on when speaking with her was how these affect her in all of her different career paths. So in her research, that this is something she's now focusing on. While as an educator, she's worried, about the caliber of doctors that we're seeing come into the field, and whether or not these doctors are going to be prepared to take care of patients outside of the state and even within the state. Do these doctors understand what's being asked of them and what to do in these emergent situations?
And those were some of her main concerns. What about the other doctors you spoke with? What were their main concerns going forward?
I think their main concerns kind of echoed those of Dr. Beasley. They're worried, they live in fear every day doing their jobs, is what they told me. They told me that going into work and not being able to use those evidence-based care practices and have those conversations that matter with patients has been really hard on them. But they want to stay in Texas for their patients and continue to advocate and use their voices and speak with journalists like me to talk about how they're seeing these impacts. I think another thing that they really wanted to emphasize within my interviews is that this goes beyond just abortion care. This affects women's health care in terms of miscarriages, in terms of ectopic pregnancies. These are things that they're seeing every day in their line of work that they're not sure how to navigate and how to handle.
Great. Well, I know that you worked on a few graphics, some charts for your article. Let's go ahead and talk about those. Let's pull up that first graphic. What is this? What are we looking at?
So right here, we're looking at some of the main takeaways for me from the Manatt Health study on abortion impacts on OBs in Texas. They surveyed all of them, and these were the results. 76% of doctors echo what I just said about the ones that I interviewed. They don't believe that they can practice according to evidence-based medicine. And what that looks like is they feel that their conversations with patients are limited. They feel that they can't provide the full scope of care that they were trained to provide. And then you see here that 29%, almost 1/3 of doctors almost, feel that they don't have a clear understanding of the law. So the law has changed a little bit over time. At first it was the heartbeat bill. Now it's a total ban. A doctor now that performs an illegal abortion faces a $100,000 fine, life in prison potentially, and they would have their licenses revoked. So for them, they're kind of walking on eggshells in terms of how they practice, and they don't understand what the limitations are legislatively. And then 21% of those doctors have considered or are planning to leave the state of Texas for another state. So that means our already dwindling workforce will see even larger numbers, bigger impact. And then 13% of those doctors are planning to retire early as well. So we're seeing about 30% of our workforce moving out of state or leaving early and having trouble retaining new talent because of what we talked about previously in terms of training.
Wow. And this next graphic is a little hard to read. It's a little far away, but explain to us what we are looking at here.
Right here, we're looking at a map of rural hospitals. So which hospitals in rural areas have labor and delivery care and which don't. So the ones in blue, those do have labor and delivery centers. And then the ones in orange, those don't. So you can see here that a good part of the state, a good part of hospitals in the state, although they are working hospitals, they don't have labor and delivery care centers. So that's something that would have to be part of a mom's plan in terms of how am I getting to the hospital? How much time do I need to leave before I think I'm really going into labor?
Wow. And it looks like there's a lot of areas that are that orange-yellow color. Mm-hmm. So hopefully, like you mentioned, there's a change soon within this industry. Well, we talked about your article. If anyone is interested in going to read more about Gracie's article, it's going to be on our website, kxan.com. You can find it on the homepage. The title is Texas Abortion Legislation Could Deplete Women's Health Care in the State, OBGYNs Say. And what is in this article that we didn't get to touch on that you want to share to our viewers?
Definitely, I think reading the perspective of the doctors that I can't really provide is really honestly emotional for me. Hearing them talk made me tear up a little bit. And also, like Liza Meyer, who we're looking at right now, she kind of gives us a perspective that we haven't really heard. She wants to stay in Texas. She's really passionate about what she wants to do. But these concerns are, a big part of her decision when applying into residency programs. Another thing that I didn't mention that I think is really important is residents. They're 29, 30 years old. They have established lives and families. So for them to have to pick up and move for 3 to 4 weeks at a time, it's not always feasible. So that's another thing that we're seeing medical schools struggle with here, how to fund that, how to encourage students to do that. But moving forward, I think doctors are really hoping that legislatively we see some improvements. We see some improvements in clarity from the medical board, and that overall we're able to recruit and retain more doctors.
Thank you, Gracie, for sharing your story with us and explaining in depth all the things that you reported on, all the things that you learned throughout your experience reporting on this story. Now, what's next for you? I understand this is your last semester of the school year. Do you have more school? Do you plan on graduating anytime soon?
So I am graduating in May with a degree in journalism and a minor in business and public policy. This next semester, I plan on focusing, I'm trying to learn a lot more about the legislative session here in Texas, so that will be definitely one of my priorities, how to report on these type of things. I also am planning on just applying for jobs, looking for jobs, and also just finishing up my studies. I'm taking a lot of my business classes next semester, as well as reporting Texas with Dr. Kate, who is one of my favorite professors. But I am just really excited for my last semester at UT with my friends and getting to soak in all that Austin has to offer.
Awesome. Well, thanks for joining us, Gracie. If anyone, once again, wants to read up on her article, look at those graphics again, it's on our website, kxan.com. You can find it extremely quickly on the homepage. Gracie, thanks for joining us, and good luck with your future.
Thank you
and
so
hopefully
much.
we see you on air soon.
Thank you.
And that's all we have today for KXAN Live. Remember, we have a couple more streams happening throughout the rest of today and into tomorrow. We hope to see you here and join us. Again, my name is Esmeralda Zamora. Thank you.